Okay. Narrative therapy is an Australian-based psychology therapy that makes the client the focus and the expert in their own lives. It's a strength-based, client-focused therapy. Well, in my opinion, everyone should use narrative therapy, and it just becomes a way of life. The basic principle of narratives of respect, curiosity, and generosity is something that we should just use all the time. Narrative therapy should be applied at all times, in all sessions, and it can be used along with all other types of therapies as well. So you can add in bits of cognitive therapy or Santre or art therapy. But the basic principles of narrative that are respectful and of curiosity are things that can be used in all sessions at all times. An advantage of using narrative therapy with people with intellectual disabilities I've found is that this client base often has great difficulty with abstract concepts, and those are all the emotions, all the feelings, and often relationships. So narrative is a very good way of making these abstract concepts more concrete. Narrative therapy would be used constantly throughout the session. You would just use different techniques. We only really showed one very brief technique with the externalizing in the video, but there are so many different techniques that are considered narrative practice that could be used constantly to gain whatever outcomes you're looking for within the session. Narrative therapy as an advantage for counsellors, I think, is that you get more of the client's story, that it gives them a place to be, and you get to have a stronger understanding of how things are for them. For a client, an advantage of using narrative therapy would be that they are able to actually have a greater understanding of the problems and difficulties in their lives that are influenced by the trauma that they've experienced. And I guess by making for example, when we externalize the problem, by actually making the problem more concrete, it gives the client a place to stand and to build a team with the counsellor's help, to build a team to stand with them against the problem in their lives. They have the lived experience with the problem. I don't have that, but I can help them understand how that problem is now influencing their lives today and how that's affecting the relationships and the behaviours that they have today. To conclude a session of narrative therapy would be, like any session, was to check the safety of your client and make sure that they're actually in a safe place. So I would probably ask a client, once I'd checked that we were okay with what we talked about today, was there anything else they would have liked to talk about? And then I'll check what they're going to be doing this afternoon, just to move them forward into the present and then into the future. So they're not left in that position of the problem, where the problem's really strong. You'll move them forward into today and then into the future of where they're going from here.